This is the Mechanical Care Forum, episode 391. It's season 13, and we're highlighting the McKenzie Institute International's Diploma program. Join me with Tina, Tim, Emily, Davide, Mehdi, and Ruchi. We've been accepted, we've begun the theoretical component, we've connected with each other, and we'll have to complete both this theoretical now and the clinical later. We're following our experience and also getting input from some of the instructors and past graduates too. All this season on MCF. Hey everyone, and welcome back. It's been a little while since I've dropped our last episode, but there's a good reason. After many years of hoping to pursue the MDT diploma program, I've finally met a moment in life where I can make it work. And it's our topic for this season, season 13 of the podcast. I'm very pleased and excited to share that this episode is brought to you by the McKenzie Institute International. If you don't know, the McKenzie method of mechanical diagnosis and therapy is globally recognized as a leading treatment for back, neck, and extremity disorders. Personally, MDT has made the single greatest positive influence on my practice, hands down. The McKenzie Institute International offers the diploma program to those professionals who have achieved prior certification in the method. If you're interested in learning more, well, for one, stay tuned and be sure to follow us along through this season, season 13, as we highlight this year's cohort of students through the program and get perspectives from past graduates and even some of the faculty. And secondly, be sure to go to the website to learn more about the program and how to apply. You'll find that by clicking on the Education tab and scrolling down to International Diploma. Just go to mckenzieinstitute.org. So here we go. We're getting started today with some introductions to allow you to meet some of my classmates. A nice diversity of younger and older students, and from a span of locations across the globe. From New Zealand to the US, from Denmark to India, Canada, and more. Today you'll meet about 7 of us. You'll hear our story, where we came from, our clinical perspective, what prompted our interest in the diploma program, and our initial impression as this discussion occurred within the first 2 weeks of starting the program. So stay tuned through to the end to hear what's in store in the following episodes. All right, here we go. Season 13, highlighting the International MDT Diploma Program. Enjoy. So our first two to join me for my classmates here of our Diploma Program 2023 for McKenzie Institute International Diploma Theoretical portion is Tina Olson and Tim Davis. Tina, thanks for joining us from across the pond.
Thank you.
Yep, and Tim, appreciate you being willing to join us as well.
Yeah, absolutely, Jason. Been listening to you for years.
Awesome. Yep. No, I appreciate that. So let's first just talk a little bit about your background a bit, just to understand where you're coming from a, just where you are in life and what the setting is where you are. Tina, start us off here for a moment. Tell us where you are and just a bit about your personal life, if you care to. I'd like to kind of get an idea of who's got what in terms of family, because it's going to help people get a picture of how much they have to juggle life in general, along with work, along with the diploma program. So Tina, share a little bit about yourself.
Yeah, I live in Denmark, and I've been here almost the entire life, and I work in clinical practice. I have a small practice on my own. It's just me and another girl. She's working part-time. I educated from physical therapy school back in 1995, and I did the McKenzie courses, they were called at that time, in the late 90s. I did the credential exam in 2001, I think it was. So that's pretty long ago.
Yeah. Excellent.
And well, I have 3 kids. One is 24, one is 20, and the last one is 16. And I couldn't do this before they were kind of grown up because there has just been a lot of work with those kids. And I always wanted to do some kind of further education, but it wasn't time before now to me.
Yeah. Tina, talk to us a little bit about your school, physical therapy school itself, physio school there. And maybe what's the climate like in physio there in Denmark? Are there certain approaches, or what was popular both when you were in school and maybe when you started the McKenzie work, and why did you choose that?
Why I chose McKenzie originally?
Yes, back in the 90s when you were first exposed to the courses and considering doing the credentialing.
Yeah, the McKenzie program was was growing, coming up, and I thought it was exciting because, you could either do manual therapy or you could do the McKenzie. That was kind of the only ways at that point if you wanted to be in private practice.
Yeah. Okay. Gotcha. All right. So we'll come back to some more questions to you, Tina. Tim, share a little bit about your background, family, or where you are and what all you're doing in terms of work.
Yeah, I'm from Illinois originally, just a little west of Chicago, and I finished physical therapy school in Illinois at Governor State in 2019, and then moved to Montana right out of school. I found a position here with some McKenzie therapists and thought it was a good opportunity to be able to work with a couple of people who are already experienced with the system. So I just moved out here out of the gate. Finished the credentialing exam just a couple of months ago, so I'm still fresh.
That's excellent. And rolling right into the diploma program.
Yeah.
Yeah.
Time
Get it
wasted.
done. Yeah, that's great. Or a glutton for punishment, one of the two, right?
Right.
Yeah, Tim, you're a single guy out in Montana.
Right.
Yep, gotcha. So a little less to keep you busy, but I'm sure life's busy enough. You're working full time right now, yeah?
Right. Full time and a couple of kittens. So yeah, pretty busy.
Okay. Excellent. All right. Thanks, Tim. I'll just share just a touch, just so people kind of have an idea who don't know my background. Went to PT school, graduated in 2001, so just a couple years behind you, Tina. Certified in 2006. Wanted to do the diploma all along, but life was busy. I was the primary income source for our family. We've got 4 daughters. Our oldest is 24, like yours, Tina. And then we've got a 22 and an 18-year-old and a 15-year-old. So our 18 and 15-year-old still at the house here. My wife is a teacher, and she kind of keeps these kids, fed and on their way to school and that kind of thing, while I'm juggling practice in a solo cash clinic about half the time. And then my other half of the time is working on these online resources, the podcast, and then case conversations, which we talk about cases, have expert clinicians kind of walk us through a case and just talk about how they clinically reason. And then the Inside the Science, that research podcast that we try to highlight scientific papers and just those that might be more relevant and might impact our clinical reasoning as well, or our behavior in the clinic. So now that we've gone through week 1 and 2, we got some work to do on my improvement of how I assess these studies now. So that's been good already. So give us a little bit of more information about your consideration and the timing and all with you doing the diploma program. Tim, start us off on that. You just finished up the certification here just a couple of months ago. Who did you talk to? Who were the influences that made you think, I want to take this further?
Really, for me, it was just going through, spending time with the clinicians I work with, as well as just the time spent on the courses. Basically, every time I see one of the faculty members see a patient, I'm just scrambling to write something down in order to bring it back to the clinic. Just the way they're able to reason through a case and at the same time really clearly communicate it to the patient. I thought they were doing something at another level, and I just want to become better every time I see them doing that. As you know, I've done some of the training with IMC. I haven't taken their test yet, but hearing Mark Miller go through a lot of his presentations and the way he's able to convey a message to a patient as well as to the other clinicians he's training, just seeing these people go through their expertise it's been just a pretty big inspiration for me. So just a lot of time spent either talking with or listening to a lot of really high level clinicians. It's really just makes me want to be better.
Yeah. No, I think we can have some similar ideas, and appreciate that very much. In your school 3 years ago or so, you're finishing up your physical therapy degree. Did you have exposure to McKenzie or MDT, or what was it?
I did, yeah. One of my faculty members gave us a presentation on it for a day or two in class, and then Annie O'Connor was actually, her and Melissa Watson came out for a full day teaching us about pain mechanism classification. And just from there, I was pretty sold on needing to learn at least a little bit more on the topic. So that really got me interested to start, and I was able to have a clinical internship with a MDT provider in the Chicagoland area, and just seeing the difference from what he was doing just kind of made sense in my mind how he was doing things a little bit differently. So
yeah. Tina, you've already told us about how life was just in a place where you needed to raise those kids of yours, and it wasn't really a possibility soon after you certified. But who were you around, and why did you retain that interest all these years later, almost 20 years later or so, and finally come to the position where you think now's the time to do it?
Yeah, actually, I've never worked with anyone from the MDT program. I have never had any colleagues really that was interested in that field. I even had a colleague telling me 20 years ago, "Oh, McKenzie is dead. Don't even bother about that." And I was kind of annoyed with that. But I kept on working, and I also found that the teachers that I met, they were so structured, and I always came home from a course thinking, wow, I really can use this. It's just take it home and use it immediately. That fascinated me a lot, and I always thought if I have to do anything more of education, this is going to be the way. And then for the last year or so, maybe 1 year ago, I wasn't really happy about my work any longer. It was getting a little not boring, but just doing the same and same and same for now 27 years in the clinic. So I just thought, well, it's time for me to do something now. And I've been doing a lot of different courses in all kind of fields. But for now, I just want to really dig into something.
Yeah.
So I guess that's just because something really needed to happen, something big.
Yeah.
So this is going to be the way.
Yeah. So having gone through lots of different approaches or different courses on different things, why not pursue those things to really dig in and go deep with something rather than this MDT diploma program?
Oh, I think this program has the best offer for the learning experience, and the other fields didn't really have that. I took an education as a lymphedemic therapist 10 years ago, and you cannot go further. You can just study it yourself, and there's no other possibilities. And I think that's mainly the reason, also because I primarily see people with musculoskeletal diseases.
Yeah. Okay. Yeah. Okay, guys, this is not an easy program. It's not cheap, and it's not minimally imposing in a person's life in terms of the commitment, both in the theoretical, and we know later on we'll be going places and staying there and seeing patients with someone breathing down our neck, we hear. So were there any of that internal discussion in your mind about maybe this is going to be too much, or maybe I'm not cut out to do this, or are you just pretty tough and gritty and resilient in your mind that's not going to keep you back? Talk a little bit, Tina, about any of that inner turmoil that sometimes people have about being hesitant to commit to something like this.
Yeah, I've definitely been hesitating because of my age, because it's so many years ago that I studied. I thought, well, are you actually able to learn anything? I mean, can you put it in your head? Is it still possible to put something in there and to remember things? And I must say that the 2 first weeks, they have been tough on me because it's such a long time since I was there last. I haven't really been good at reading articles it's all also, as I haven't been using MDT very strictly, I've been using all kinds of stuff during my day. So now I'm trying to get into the MDT process again and really doing it that strictly. And I see that it works.
Yeah. Cool. That's excellent. Well, I will say this to you right now that I've told other people. I was telling Gary Dykes, who I just saw recently at a course, who will be actually one of our instructors this coming week, I think. about you specifically, and I'm thinking, wow, to not be speaking English all day, every day, and then suddenly have to communicate in English. Obviously, your English is excellent, but I'm sure it's a challenge. No, it really is good, but I'm sure it's a challenge to suddenly have to just flip and be quick and be communicative and articulate, on what your comments are. So I think you still have it in you. I'm sure that you'll do fine. But anyway, yeah, I'm sure it's a challenge.
I'm not sure, but I'm trying. And I'm willing to give it a try and work my butt off. And I'm really working my butt off, I think.
Yeah, good. Tim, talk to us a little bit about any of that inner turmoil that sometimes we have and we consider, jumping into something as committed as this might be.
Oh yeah, I mean, it's definitely intimidating. As, where I'm at in my career, I mean, I'm going on year 4 here in a few months, so I'm still relatively fresh, and to be in a situation where I'm going to be in a room with an absolute expert who probably knows quite a bit more than I do as far as what we're doing out there. It's definitely intimidating for me, but yeah, I just feel like it's a nice opportunity, and anytime I see myself getting forced into a situation that's a bit of more of a challenge than I'm used to, I'm better off for it. So it's a nice opportunity for learning, especially where I'm at in my career, my life right now. So
yeah. Sometimes when we get into something like this 2 weeks in, it's hard for us to remember maybe what we were thinking and anticipating, what in our mind's eye we expected the program to be like. Tim, did you have any kind of ideas, and has it been a lot different, or has it been about what you expected, or did you know what to expect?
I wasn't exactly certain, but honestly, I think starting off where we have, it's been probably even better than I might have expected, because I mean, we spent so much time just on applying just skepticism to what we're doing as far as dissecting articles and trying to get the best information we can. So it's definitely been different, but I wouldn't say I'd want it to start any other way, because it's probably setting us up for not only success in this program, but just long term, as far as getting the best information we can from research, knowing what to pay attention to, knowing what's maybe not the strongest evidence to be trying to apply, and where our biases might lie. So I think our starting point right now has been, I think, really valuable.
Mm-hmm. Tina, do you have any remembrance of maybe what your thoughts were, or what you thought it might be, and has it been what you thought it was going to be?
I thought it was going to be tough, and it really has been. That's it.
Okay.
I'm finding myself reading, even though it's 9:00 in the evening, and yeah, I think I spend more time in here than I thought I would.
Okay. Yeah.
But maybe it's because of the language barrier. I understand quite a lot of what I hear and what I read, but then when I have to comment and I have to write, then it's always getting a little harder, because then I have to use a dictionary quite a lot. What I know the Danish word and I know what I'm going to say, but how is it in English?
Yeah. And so just to kind of help people understand, there's a bit of a nice easing into this with an orientation week. I think Richard was trying to help not run us off too quickly, and then quickly.
But I was ran off because I hadn't seen the course materials for 20 years, so I had to read it all over.
Wow. Okay.
And then they were like 200 pieces of paper each.
Yeah. That's a good point.
And I didn't know where the new stuff was. I had to read it all.
Okay. So not so much of an easing in for you, but comparatively, he was not too withholding to tell us that it's going to get more challenging. So we've got more to look forward to.
Yeah.
Well, what we hope to do with this is just give people a good picture of what it is, because I think, a lot of times people rule out the possibility because of some of the commitment, or they just think, if I don't want to teach within the institute, there's no sense in becoming a diplomat, which we understand quite clearly that not all diplomats go on to teaching. There's plenty of other things to do, or just to learn it for your own clinical skills. But so we hope that what we can do is convey and give a more accurate understanding of what all is involved, and maybe just different people's perspective where they are in life and in their practice and their career. So I appreciate you guys sharing this. Just got some new material. How are you guys feeling about that? And what are you thinking about the next few weeks? Tina, you want to start with that?
I think it's going to be interesting because now it's getting more clinical, and you can start to use the experience that I've got for many years. So I think it's going to be a little easier.
Yeah.
Because also we might use words that we are used to.
Yes. Okay. Yeah. Good point. Tim, what are your thoughts?
Yeah, I think I'm looking forward to getting a little bit more into the clinical side of the research and how to apply it in the clinic. It's a really helpful start getting into just really good at analyzing it and now being able to apply that and then put it right back into the clinic. I'm really looking forward to that, as well as just hearing everybody's perspectives, because there's a lot of people with a lot of different experiences and background in this field. So I'm just looking forward to learning from everyone really who's involved.
Yeah. Good. Excellent. Well, listen, I've already gotten to converse with Tina quite a bit since we're grouped together on this first bit, but Tim, I haven't chatted with you as much. So it'll be nice to get to know everyone better, and you as well. So I appreciate you guys hopping on here. We're going to let you guys have the rest of your day and your evening before we jump into week number 2, I guess. And I look forward to chatting again at some point in the future, kind of just to pick up where you are and what you've learned along the way. So thanks, Tina Olson. Thanks, Tim Davis. We'll be talking to you guys soon.
See you.
Yeah, thanks a lot, Jason. Thanks for all your work.
Okay, so that's your introduction to Tina from Denmark and Tim from the U.S. Here's another introduction to Emily, also from the U.S., and Davide, working in New Zealand, but currently and originally from Italy. And so welcome Emily and Davide, our next 2 from my classmates in this 2023 diploma program cohort, the second of the group that I'm talking with this week. Davide and Emily, thanks for joining me today.
You're welcome. Thanks for organizing.
Welcome, Jason. Thank you for having us.
Yeah, absolutely. So before we get into some of the reasons why you considered the diploma program and some of what you've done in the background, why don't you just give us a little bit of information about where you are and kind of your professional responsibilities, as well as a little bit about your family life, so we can kind of get a whole picture of what all's going on with your life while you're trying to accomplish something like this in the diploma program. So Emily, you want to start us?
Yeah, sure. I'm an orthopedic physical therapist up in Vermont, so northeastern US, and I've been doing orthopedics for about 13, 14 years. And initially I started in private practice, not my practice, but a private group. And then I sort of ended up in more of a hospital-based type of physical therapy clinic. And that's still where I am right now, in a hospital-based clinic. So responsibilities, mostly just patient care, no managerial stuff right now, just patient stuff. On the home front, it's equally crazy, I would say. I have a 5-year-old son, and then I have twin boys who are 3.5.
Okay.
So yeah, it's not the most ideal time, but I figured it's not going to get any better. A couple of years ago would have been worse, but it's not really going to get much better. So I figured I might as well just take the plunge now.
Got it. Emily, it's funny you say that. We were talking with Tina and Tim with the last group that I just chatted with about similar questions and all. But I was telling them that I was at a Part A just yesterday and this morning some. And one of the students at Part A was asking about the diploma program and saying, well, I've got 2 small children. I said, well, we're getting ready to run a season 13. That's going to be a little description of several of us that are in it. So we'll find out if others have children. So there we go. So you're going to help somebody get an understanding of just how miserable it's going to be. No.
Yeah, I figured, as long as you can get all your kids out of diapers, and they're at least aware, they can discuss with you what you're doing and why you're gone for 9 weeks. I figured that was at least the threshold. Anything that was before potty training or clear dialogue, it was not going to be realistic. But I finally crossed the threshold. So
okay,
there now is okay.
It's good to understand.
I might regret it in a couple of weeks. We'll find out.
We'll find out for sure. Davide, why don't you tell us a little bit about your background, your clinical work, what you're doing, and as well as a bit about your family, if you care to.
Sure. My name is Davide. I'm originally from Italy. I was actually born in Rome, but my family is from Sicily. So all my parents are Sicilian. And I've been living in New Zealand for the past 12 years. But now, like a month ago, in December, me and my family decided to come to Italy and we'll be here until the end of June, just to reconnect after those crazy years that we had to be away, as everyone is well aware. And in New Zealand, I work in a private practice as a senior physio, and I do mostly clinical work, musculoskeletal work, but part of that, I'm also a vestibular physio. So I got a role in our concussion team. We do concussion management treatment in New Zealand. And as a side work also, I started doing some education, working for World Rugby. I'm an educator for a course called First Aid in Rugby. So I've been teaching that in New Zealand for the last couple of years as well. And then in terms of family background, like Emily, I got 2 young children, 4 and 7, older boy, younger girl. And yeah, like Emily was saying, there's never a right time because, like you say, that can be younger, they're older, there's always something going on. So I think from my side, getting to this diploma is something that we'll talk maybe a little bit more in depth soon, but it's been progressing for a while. And for me, being able to come to Italy at the moment in a half sabbatical stage was a good time to get this started. So at least to get the theoretical part of the diploma while I'm here at this stage, which so far has been good.
Good. Yeah, Davide, help us understand then, right now, are you doing any of that teaching on concussion or with rugby? Or are you doing any type of clinical work right now?
And non-clinical work, but I'm doing some education teaching in Europe, but in a casual way.
I see. So
it's not too much.
Less. Yeah.
Yes.
Okay, less than usual, but something there. And then, of course, you're going to have plenty of your time filled up with all this reading and case studies and all writing with the program.
Yes.
So, yes. Not too much extra time, I'm sure. Good. So help us understand, you guys, from your perspective about your training before, and how are you introduced to MDT, and isn't just getting credentialed enough for you? Why go this further distance? Davide, I want you to start us on that.
Sure. No, thanks, Jason. Look, so my first introduction to the McKenzie method, the MTT, happened during university, not because this was part of our curriculum, because it wasn't, but I remember one teacher just randomly mentioned that the McKenzie method was something that existed, and even though it wasn't taught in our syllabus or curriculum, it was one of the few methods that actually had some scientific evidence on its background. So that kind of like prompted my interest. And so I did some research, and then me and my colleague of mine, we wanted to have an overseas experience after graduating and say, why don't we go to New Zealand? And McKenzie was the main excuse of the year abroad, even though it was only like 3 long weekends. And but say, we're going to go there and we're going to have this experience. So that's how I started my Part ABCs in New Zealand. I was very lucky actually to have Robin McKenzie in the Part C that I attended back then. He was a special guest on top of a dream team of teachers. There was Watty, Greg Lynch, Grant Nuttridge, rest in peace. So he was, very lucky then.
What year was that? What year?
That was in 2008.
Okay, gotcha.
2008, yes. And then I came back after the year. It was a working holiday visa, so I spent a year there. And on top of learning about McKenzie, there was also the year that I met the girl who's now my wife. She's Kiwi, she's from New Zealand. And that's one of the main reasons also why I'm living there for such a long time.
Gotcha.
Yeah, and then I came back to Italy, finished my party here, did my credential exam here. And like everything I started, I want to go all the way through. So the diploma was always in my bucket list. And like I was mentioning before, been procrastinating for a bunch of reasons. I guess the timing, the financial reason probably was the main thing, obviously, that stopped me from doing it. And so this time we decided that after lots of talking with a number of people, and we found the timing is right, I was very lucky to get some financial support in pursuing the start of the diploma. So I signed up in the end. And now I'm here with all of you.
Yes.
Both of you.
Very good. When were you credentialed then? What year?
In 2010.
10. Okay. So quite a while then. Yeah. Excellent.
Yeah.
Good. Emily.
Yeah, I mean, a lot of similarities in a way. I did not get the chance to go to New Zealand to do Part A through whatever, but yeah, similar. So I think you mentioned that you just took Part A in 2008. I actually took Part A in 2009, so not too much far off. But then I didn't get credentialed until 2013. So I kind of did one course a year, and then 2013 did my credentialing. So when I graduated from college, I wanted to be a traveling physical therapist, and that's what my first job was. However, the way the economy was in the States, they couldn't get me a contract as a new therapist. So that actually never sort of set sail. So what I ended up doing was just randomly applying for jobs in the States where my traveling company had gotten me licenses, and one of them happened to be Maryland. So on a whim, I just interviewed at 3 different places, which was probably it was a flight from where I grew up. So it was definitely moving away from home, knowing nobody. But I happened to land in a private outpatient practice that was just McKenzie based. We had maybe an hour of MDT awareness in our college program. So I don't think I really even knew what MDT was. I just knew what orthopedics was. And honestly, I really thought I was going into acute care when I graduated college, like spinal cord injuries and, ICU stuff. That's where I thought I was headed. But literally within 30 days, everything changed and I was plopped into an orthopedic world, and here I still am. And everything happens for a reason. I'm really glad that I ended up in this, and this is really truly where I want to be. I just never thought that I would go this route. But landing in that practice, my director was certified in the McKenzie method. And so, they just hired 2 new grads at the time. So myself and my other colleague, we were both new grads, and they really wanted the 2 of us to take Part A. They just kind of wanted to mold us, of course, as fresh new clinicians before we ended up maybe going on different pathways. So we both took Part A with Hugh Murray that summer in DC. And then
No.
he was awesome. Yeah, I remember it vividly. It was great. And that was a really great experience. But again, I didn't know any different. So a lot of my colleagues that are either MDT trained or non-MDT trained, I don't know any different, from day one of being an orthopedic practitioner. That's kind of what I was molded into. So for better or for worse, I think there's pros. There's a lot of pros to that.
Absolutely.
But that's kind of molded sort of why I kind of stuck with MDT track. And then went on to get certified. And since then, I did my orthopedic manual therapy certification through the University of South Carolina in Charleston. That was good, different, but it also did talk a lot about Part A and Laslet and all that stuff. So it was nice to see almost a 4-hour Part A course, condensed from 4 days, but at the beginning of that orthopedic manual therapy program. So to me, that valued MDT, even though I thought it was a very non-MDT approach to something different, to almost play devil's advocate to myself. I thought that they complemented each other really well. And then in the past few years, I went on and got my OCS, which again is very different. It's more pathway anatomical, but another kind of devil's advocate for myself, just looking through a different lens. But again, I still kind of come back to the MDT structure as where I start most of my exams.
Yeah. So Emily, you've got this manual certification. You're an orthopedic certified, specialist. Isn't that enough? Why in the world are you?
No.
Yeah.
Well, again, I think looking at all of that, I still treat patients and I see patients where I'm like, I know there's a mechanical thing here. I was like, if I had a little bit more knowledge, I feel like I could solve the mechanical puzzle that's sitting in front of me that I know that I can't solve with my clinical prediction rules and manipulations or whatever, special test clusters I learned through OCS. I feel like there's mechanical aspects. Like when there's pain during movement, there's, that transitional pain. And even non-derangement stuff. I feel like there's mechanical answers that I just don't have enough knowledge to solve all the time. And so it's not always going to be mechanical. And I just really want to be the best at knowing when can I help somebody, when can't I? And if I can help them, how far does mechanical stuff take me? And then when do I know that I need to reach out towards, other complementary medicines or whatever it may be to optimally really avoid surgery and invasive measures when I can. So I just think that the credentialing is great. It kind of gets you to a certain point, but it's like the tip of the iceberg, I guess. Even a lot of studying I've done, even through your podcast and some other stuff that IMC has put out, it's just taken the whole knowledge base so much higher that you can't get to it all in parts, A through E. So I guess kind of like I said a minute ago, just take it to the next level to really, thoroughly know that I've exhausted mechanical stuff and I've taken my patients down the right algorithms and I know truly when to pull in other stuff and when people truly need surgery and they don't belong in our office.
Yeah. Davide, you might have colleagues out there that have been connected with you for a long time, and they hear that you're in the diploma program, and maybe you've even had a conversation or two in the last few days or something with a colleague. What do you tell them so far about what's it like?
What's it like? Well, the start has been, it started quite challenging, I'd say, which is what I was hoping to say, because, of course, like as MDT clinicians, when you do your credential, not to be able to apply the McKenzie or MDT method, you got to have your knowledge or the principles of that. And so, but knowing that what the diploma could do for you and what you learn there, I found that it's been quite challenging, but at the same time, good to get your brain going. I think that the teaching of this diploma really kind of reflects the clinical approach to patients. I was telling Richard the other day that it's like the way that they encourage your critical thinking is like the same way that you apply clinical reasoning to when you assess a patient. So I found that quite reflective of that. And so when I talk to my colleagues, and I have spoken to my colleagues in New Zealand, they work with me, I say, I'm glad I'm doing this now while I'm here, not while I'm working.
Yeah.
Because then it's very demanding, not just time demanding, but also like energy, your cognitive load you're using on top of your family and your kids, etc. So I'm really glad to have those hours when, for example, the kids are at school. Well, I'm not necessarily at work, but I can dedicate my time to the diploma, probably, because I guess that, and talking to some of you guys that are working at the same time, I understand how much more challenging that will be.
Yeah. Emily, walk us through the last week, just in terms of how are you handling reading, studying, communicating back and forth on the platform with this cohort about the summaries and all that we've been working on, going to work, taking care of the kids. Walk me through a day. What's it look like?
The first week was rough because my husband had COVID. So we were living out of my mother's living room. So it was not what I planned for. I got a little nook in my bedroom, which is where I am right now. I've got like a desk and I had this all awesome setup to use so I could just have my own little personal space for reading and studying to focus my thoughts. And that first week, obviously, that was all shot. I was on my mom's island trying to quickly, look at different blogs and just with kids around. So the first week is not what my typical week is going to look like. However, what I've done is, my typical work week's about 40 hours, like most folks. Over the last year, I cut down to 36. So for me, 36 was normal. But for this, I've cut down to 32. So I kind of dropped my hours and I spread my hours out a lot. So I've actually blocked about an hour and a half to 2 hours throughout my work day, twice a day. So I just kind of mentally go to work from 7 to 5:30 every day. And then either I start with online reading discussion or I start with patient care. But again, there's a solid hour and a half to 2 hours twice each of my work days where I can just clock out and go to a corner and just focus on the diploma program, which has been really, really helpful. And I think that's really helpful with discussing with people because everybody's in different time zones. And what a colleague of mine who did the program last year really recommended was just make sure you can get on a few times a day. And that was kind of her advice was, having at least 2 sections during the day, and then I should be okay. And as much as I'd love to be on there more, I feel like that's at least been adequate to kind of keep up with everything. If I get like a 15-minute window, I can then quickly log into the platform and, do a little bit additional, which is awesome. But I feel like if nothing else, at least those 2 blocks give me time to really at least stay on top of things. And then I think in the evenings, I'll do readings and, pull up the YouTube videos. So I'll spend a couple hours after kids go to bed. But pretty much, the end of my typical work day where I normally pick up the kids, normally have dinner with the family, that hasn't changed much. Like that part of my routine has stayed about the same. But again, I just then have to switch gears and I don't get to watch TV or do other stuff in the evening. I just put them to bed and then I got to go study and go do some reading.
I was about to ask, how did you decide to handle it that way? But you've clarified that. You had a little inside hint from somebody who's gone through the diploma program.
Yeah, so. And I was really fortunate. And I was even thinking too, because you asked kind of what we expected. And was it what we expected? I don't know what I expected, to be honest. But I know that I've been talking with her even before I decided to take the plunge to go through it. And she had kind of walked me through just kind of what they were doing. So I wasn't really surprised. But I do have like my coworkers, when I go and clock out and go do my diploma stuff, sometimes we'll just say I'm off to go study, or they say off to go study. But when you think about it, no, we're not. Like most certification programs, you've got things to read, you got to study, you learn physical things. Well, we're kind of beyond that point in this. This is more just critically analyzing literature, which I think other people don't quite understand. They see McKenzie method, you're going to go learn how to do press ups and where to apply the overpressure and how many to do, and you're going to practice this and practice that technique. So I think they think that we're off to go study and do McKenzie stuff. But in all reality, it's quite a contrast. It's more looking to see, well, what does the whole world do? What does orthopedics look like? Not just McKenzie stuff, but really analyzing the literature. So it's different, I guess, than people would expect, but at least having a leg up, I think. I wasn't surprised at least week one.
Yeah.
I think it's great, Emily, that you managed to keep those routines in your family home. I think that's very important for you mentally to not make you feel guilty because you're not sacrificing stuff, especially with your kids. So
I'm hoping that keeps up. It's been a week, but we'll see. I mean, the caseload, I'm assuming, I don't know what the caseload looks like. I know there's a couple of weeks where it's harder, but as long as the caseload is roughly the same intensity, I mean, I think we'll just get into routine and just keep the hamster wheel going. We don't fall off.
I forgot to mention, guys, that week one started on the Sunday, the first reading came out. And then a few hours later, at 4 a.m. on Monday morning, we had to evacuate our house because of a tsunami warning following the Turkish earthquake. So, because I'm on the coast of Sicily around the border. So I had to evacuate my house for likely a few hours later. And this was called off and didn't happen. But then on Thursday morning, we had to spend 2 days in lockdown because of a cyclone. So we had a red alert storm that was just pretty much skimmed the coastal Sicily. We had 7 meters swell in front of our house. There was crazy wind and lockdown. So, and the kids were at home because the school were closed too. So that added to the challenge. A few blackouts, but yeah. So this was all in 1 week.
Oh gosh, yeah, it can go nowhere without, right? Only can get better.
Things you don't expect. Yeah.
Well, we never knew. I mean, I feel like you were still posting a lot. I mean, given all of that, so kudos to you.
Yeah, no, likely
that still didn't interfere.
Yeah, I think that on the one side, like we had to stay home, so it was easy to jump online. But I think that my concentration level at a certain time, especially when the kids were getting bored or being stuck at home, that wasn't the greatest.
Yeah. So tell me a little bit about some of those take-home pearls. Any pearls that you guys have already picked up just in the first week and a half or so? What comes to mind if I just ask you that question from, let's say, the last week? Emily? I
mean, the first one is probably bias. I think we've all known throughout our career that we're biased. I mean, I'm assuming we all are, but at least myself, biased towards the MDT, especially when you've worked on other colleagues that are, their thought processes or their algorithms are less clear. There's less definitive answers. So that's probably the first one. My other big take home is just, of course, I've never been in a situation with a group of people that are so spread out across the world. I think going through, you wonder, is this an American problem? Is this just what we encounter in the States? And in Europe, it's probably so much better. That it sounds like a lot of folks have the same sort of setup, the same frustrations, the same difficulties in healthcare and orthopedics in other countries as well.
Yeah. Anything from you, Davide, that kind of stands out in your mind from the first week?
I'm going to just be very critical of what you're reading. Would be one to understand that with all the thousands of literature that you can find, and now one understanding what value those have, and even those ones that are rated very high in level of research and RCTs, etc. And just be very mindful and critical of that, because I think that was something that always, especially initially when I became a credential therapist, said, with all this evidence the McKenzie middle MDT does, why this is not taught at a university level, why this is not recognized, even in New Zealand when it was first developed. And the answer I always got from Diploma is like, we just are not able to demonstrate that we're better than others in a way. No? But it's not about being better than others. I think it's about letting your ego out of the door and be able to know what your strengths are, what your weaknesses are, and work as a cooperate more like a holistic approach with the patient at the center of it.
Yeah. So you guys, we've been through that first orientation week, and then last week we cranked up looking at some literature just on exactly what you're saying, Davide, looking at, okay, what's good about the study and what's not good in terms of the quality of it, and what does that say about our method or other methods or whatever. Now that you've gone through this first real week, are you going to change anything about how you're approaching it, whether it's your pattern or, how you tackle the next assignment or so? Are you seeing that you need to adjust at all? Davide, you want to take that one?
Sorry, can you clarify the question? Sorry, Jason.
Yeah, that's okay. Yeah. So I'm just trying to understand. We've only had 1 week to get in a pattern, but we can kind of understand now. Each week we're seeing that we've got some assignments. They're somewhat laid out day by day. Are you going to handle it any differently just from having of the 1 week?
I reckon that the fact that there is kind of like a calendar guide at the beginning of the week when you say you should focus on this on Monday and then this on Tuesday, I find it very good because I know, okay, this is my task for today and I focus on that task. On Tuesday, this is my next task too. So I reckon that I think that first week, despite all this weather craziness, I think that I'll keep doing what I've been doing. I reckon now encouraging myself to, like Emily say, try to jump online a little bit often throughout the day. Yeah. So just to keep up, because I think the most challenging thing for me is that when I jump on and there's 5 people already commenting on something, and do I say, do I just state the obvious and repeat what everybody said, or do I just say, yeah, I agree with everyone? I think that's the part that I find probably awkward. I don't know if it's the right word to say, but yeah, more challenging because sometimes I say, like, if I jump on and nobody's coming, I can maybe put something on there, but if there's already a few people that have already, I just don't know what to add sometimes. Everything is already been said.
Yeah. Yeah. From a reading standpoint, I've noticed myself diving into that first article and catching myself reading every word of that. And while we need to read thoroughly at each one, I think what I'm going to start doing is looking at each of them real quick skim and getting an idea of what all articles are we looking at and what's the objective of this week and everything. And then going back one by one, perhaps. I don't know. Emily, you have anything that you're seeing now that you're considering last week, how you might want to adjust anything?
Yeah, I mean, of course, the whole studying at night thing, that really didn't happen last week. I was just putting my kids to bed and I'd stay with them. So that's kind of my plan that makes the most sense. So I'm looking forward to actually being able to, have personal time in the evening and just see how that goes. I like your comment of kind of skimming all the articles to kind of get a sense of a broader, what are we doing here? Why do they give us these articles? What are we trying to accomplish? I think that's a cool idea that I'll probably do before I start diving in. I did like how, I think one of the things that Richard sent out was, when you get the research article first, don't read the whole thing, just, step back, look at the graphics, read the abstract, read the conclusion. So this morning, just doing that, I thought was really helpful to get a sense of now with each article, like what's this article all about? Because in the past, I would just dive in, try to read everything, understand everything. And then 2 hours later, my brain is mush. I have no idea what's going on. And now I'm trying to interpret the conclusion. So I like reading the conclusion first and looking at all those graphics, to me, just puts it in a better context that when I then go to read the methods, it makes a lot more sense. So yeah, I don't think I'm going to change my layout too much, but just I would like to try to, log in and discuss a couple more times a day if I can. Yeah. But all in all, I guess nothing too much different.
Mm-hmm. Yep. And I'm sure that we'll have to adjust on the fly as we go through week by week depending on what's in front of us. So anything else you guys want to add this first discussion here? We hopefully will come back around in a couple of weeks and kind of say, all right, now how you feeling? Or now what have you learned? So yeah, share anything you want. Emily?
Yeah, I mean, my biggest thing is I'm excited to see what this looks like in the end, because right now, no, it's totally worth it. I know everybody says it's amazing. And part of me is like, is this really going to be worth it? Like, why am I spending all this money and doing all this? I'm 100% confident. I just, of course, right now have no idea what the next, 11 weeks of theoretical look like, or the 9-week or the stuff that goes in between. So I'm excited to see sort of what I sound like, what I look like, and how I feel in the end of all of this. Because right now I have no idea. I've just taken the leap and I have no idea where I'm going to fall.
Any additional thoughts, Davide, before we wrap it up?
I think what I'm enjoying so far the most is probably being able to connect to other 11 people that come from around the world, like people in India, US, Canada, Europe. So I think it is very cool to share not just your knowledge, but your thoughts, your experiences, and see, especially from an MDT perspective, so how is this carried all around the world. So now I look forward to connect even more with all of you guys.
Yeah, excellent. I agree. And it's been fun even just doing this for the podcast. It's been helpful to kind of just understand. So you guys will have to listen to it so you can hear about Tim and Tina and everyone else.
Definitely,
so,
yeah.
Yeah, well, I'm excited to, like you say, Davide, get to know you guys better, but also just kind of walk through this together and suffer together. And so we'll come back around in a couple of weeks, but I appreciate you guys taking a little time out. Now get back to the books.
Cheers. Thanks, Jason. Thank you so much for having me.
Thanks for organizing it. This will be a great tool, I think, for a lot of people.
And finally, Mehdi, originally from Iran, but now living and working in Canada, and Ruchi in India. So I'm pleased to welcome to the podcast our third pair of my classmates in this 2023 cohort diploma program, Mehdi Gorbenzadeh. Mehdi, thanks for joining us today.
You're welcome. Thank you.
And Ruchi Jain. Thanks, Ruchi, for joining us as well. Mehdi, why don't you start? Where are you? And tell us a little bit about what you're doing as you're starting this diploma program as well.
Yeah, I live in Canada, and I work in a small town called Beaverton. It's been almost 6 years that I've been practicing McKenzie method at that clinic. And before that, I used to work at a nursing home in the same town. So when I started working at the clinic, I wasn't very confident. So I needed to took some courses again. Mm-hmm. So I did it. And even though I was certified 9 years ago, I realized that I needed to learn more and more and more. Mm-hmm. So eventually, when I was at the party, I met Fiona McKenzie, who is a diplomat, I would say. Mm-hmm. And she was very encouraging, and she encouraged me to take the course as soon as possible, considering I don't have any family here. Mm. So I can do it easier compared to the people who have families, right? So that was actually one of the factors that I needed to pay attention to. So, and again, I wasn't satisfied with what I was able to do. So because I couldn't treat actually some certain patients. To me, the cases were very complicated. And even though I applied McKenzie method, it didn't work. So I said to myself that I needed to go further. So that was actually the most important motive.
Yeah, we're glad that Fiona talked you into it, right? Yeah. So, Mehdi, you have a family, but they're not with you in Beaverton.
Not actually. I live with my partner.
Okay, gotcha.
But yeah, and no children.
Yes. Okay, gotcha. All right.
Yeah.
I got it. Because we have some in the other groups that have 2 small children, and others that don't, that are single. And I've mentioned in it before that I've got 4 daughters, that are older, but they're pretty well independent. So Richie, tell us a bit about your family as well, just so we can understand how you might have to juggle your time with all this work that you'll be doing.
Hi. So I live with my in-laws here, got married 3 years back. I was doing my McKenzie. I got certified before my marriage. Post that, it was my husband and my father-in-law who encouraged me for it. They pushed me to set a new clinic here since the town changed for me. And that is how they both are the reason for my encouragement and doing diploma right now.
Yes. Okay. And your initial schooling in physiotherapy school was there in that same town, or?
It was in Mumbai, like it's around 17 kilometers away from my in-laws' house. So I had my private practice there in other town, in Mumbai itself. And right now I've shifted 17 kilometers away from my town. And in a new town right now, finding my new spot and trying to grow here.
I see. And so you're working quite a few hours, or how are you managing your time during this theoretical portion?
So currently it's getting a bit tougher because running my own clinic, and in India, we don't have prior appointments are being set for patients, but many of the OPDs like walk-ins, we have to entertain them and we have to give appointments. We can't ethically, it's not right for us that we appoint them for some other day. If they have come to the clinic, we have to find space to take them in.
Mm-hmm, mm-hmm. Yeah, but have you established your schedule such that it allows you some time to study and to read and to comment and all?
Yeah, so surely it is in the morning and evenings. I have been practicing for 5 hours, and in the afternoons I'm relatively free. I'm avoiding home visits, but that is making a bit of a challenge because the time zones are different of my group.
Yeah,
where it's midnight for them, 3 a.m., and it's 3 p.m. for me. So it gets tougher when in parts of discussions and clearing out my stuff. But yeah, trying to cope up with it.
yeah. And you and I are actually in the same group along with Tina. And
Yeah.
so, yeah, you've been nice to work it in after you're working, I guess. And it's my morning and it's Tina's afternoon. So we're making it work for now. Yeah. So Mehdi, talk to us a bit about any type of questioning in your mind of, can I do this? Am I cut out to be able to accomplish this? Did you have any of that self-talk of doubting yourself, or just concerns about, am I going to be able to handle the volume or the difficulty of the program? Was that ever an issue for you?
I still have that question. Yeah, there were lots of questions actually. I wasn't sure about my time. I wasn't sure about my financial status. Well, that was actually one of the most important things, I would say. And maybe because of aging, I wasn't very confident, because learning is very different when you're older, right? So I said to myself that if I don't do it now, I won't be able to do it in the future when I'm older. So I think I'm able to do it now.
Right. Yeah. I was just going to ask Ruchi, did you have any similar thoughts? And with you being a little younger, not so far from school, maybe it wasn't as much of a question in your mind.
So the questions in my mind all arrived because of my patients. When I was treating low back patients with radicular ones, PNR, stenosis, it got tougher for me because helping them partially was not making me feel satisfied. That partial smile, not getting a full smile, bright smile, I'm out of my pain. So that was the trigger for me. And with the discussions with our diplomats, Dr. Asha, Ma'am, Devang sir, I saw their approach was very simple, organized, very calm, at ease, treating their patients well in a very happy way. So, and they were satisfied about their job, doing the right thing, right time. I was struggling with this, sort of being one along with them, took this up, but it's not an easy task.
Yeah. So Mehdi had Fiona, a diplomat, to kind of give him some encouragement. What about you, Ruchi? Have you had anyone, Devang or Asha or anyone like that who you've been able to speak with and just talk about this?
Yeah, all of them, I would say. But personally, Devang sir, since I discussed each and every case with him, one of the candidates who's doing her diploma practical component right now in Canada, Sonali, she's been a very good friend of mine, and we are in the same batch. So yeah, every time before COVID, she entered into diploma, and we used to discuss about cases. That is how she used to start. She started answering in a way different way than mine, being at the same level. But so yeah, 3 years back, I used to feel, man, this is one thing which I would love to do.
Yeah, very good. So what about, not to get personal or into the specifics, but do either of you care to talk a little bit about the financial piece? Because I know that is a challenge for a lot of us to think, how am I going to sort this out? I've got to be able to pay my rent and pay for my, children or whatever we have, in our life, all the expenses, just the cost of living. Did you guys just plan it out and think, okay, I want to do this in a year or two, so I'm going to try to save back? Or have you sorted out maybe with your work that they can contribute? Or have you heard about any opportunities, that type of thing, just in terms of being able to make this happen from a financial view? Mehdi, you mentioned it a minute ago.
Yeah, but I had actually some saving.
Yeah.
And depending on my character, right? So if I really want to do something, I don't care about these things.
Yeah.
I can give you an example. When I was living in Toronto, I used to go to Roy Thompson Hall for the classical concerts.
Mhm.
So one day I realized that the work was Mozart work. And I had only $200 in my bank account. And the ticket was 150. And I purchased the ticket. That's it. So you can think about it now. I might be in trouble now.
You really wanted to go to that concert.
Yeah, I did it.
Yeah.
Something like that actually happened for this course, actually, I would say.
Yeah. Yeah. You just set your mind to it and thought, this is a priority for me, so I'm going to make it happen.
Exactly.
Yeah.
So this is actually my personality. When I
Yeah.
really want to do something, I don't care about any other thing.
Yeah.
Yeah.
Yeah. Ruchi, the same for you, or tell us a little bit about that. Or was it really a concern or an obstacle for you?
To some extent, it was.
Yeah.
But I wouldn't say it completely because I had my support system with me and they were quite financially stable.
Good.
I was still growing in just 2 years to my daily clinic, which is growing. And yeah, but they supported me well with the financial part. So
Yeah.
that was not my concern primarily.
Okay. Yeah. What was it, the time that was the more of the concern?
Luckily, I've always been with some support financially, some. So not
Yeah.
much of a
Okay.
worry.
Yeah. So there weren't too many barriers for you, Ruchi. You felt confident this is something you want to do. So we each maybe have had in our mind an idea of what the first couple of weeks of the diploma program might be like. If you think back and how you anticipated the program, and now that we've been through the first orientation week and week number 1, has it been the same as what you expected or different, Ruchi?
It was way different. Like I expected the orientation week, I thought, yeah, it's going to be nice, easy. Slowly we'll just dig in things. But no, I got the real challenge when we had to submit our first summary, where the time zones were different and I was not sure whether I'm putting my things all correctly. Because of different time zones, it was difficult for you all to reply back every time. But you all managed to quite a great extent, and that helped me. But yeah, that gave me the real world thing. Yeah, that you have to be on your toes now.
Yes. Mehdi, what about for you? Was it different these first week or two?
Yes, actually, I didn't expect that kind of work. I didn't expect that. But I'm getting used to it now. I have actually a better idea of the routine.
Okay.
So, yeah, but
yeah, what is your plan in terms of when do you read, when do you write, when do you comment, or do you just try to sneak it in when you can, or are you trying to keep that somewhat scheduled in your day?
I try to keep it scheduled.
So are you getting up early and trying to get some of that done before you go to work, or are you doing it afterwards, or?
So whenever I'm able to do it,
Okay.
It doesn't matter. So one night, actually, I stayed up till 3 o'clock in the morning. So depending on my condition and situation.
Okay. So you're just trying to play it by ear and respond when you need to and fit it in.
Yeah, but for the last assignment, actually, the problem was the internet, and we didn't have actually the internet service for a few hours, so I was behind. Yeah, just a few minutes before the deadline, I posted actually the assignment.
I see. Yeah. So sometimes we're talking to our family or maybe some colleagues about getting ready to embark on something like this, the diploma program. You might have had colleagues ask you, what is this diploma program and what is it going to do for you? Ruchi, did you have anybody ask that question?
Yeah, many of my friends, like my colleagues who are into neuro, few of them into MSK, they are intrigued in what is it about? You have done your certification, so what do you want to know more about?
What did you say to them? Yeah, what was your answer?
It's just that it's a learning process and you have to keep growing and to keep learning, be updated.
Mm-hmm. Yeah. Mehdi, did you have anyone ask you, why are you going back to study more, or what is this going to do for you?
Yes, some people actually asked me about the reason, and what I said was what I really thought about. I need to go further. This is actually, again, associated with my personality. I cannot stop forever around the same spot. So I'm not satisfied. I need to go further as far as I can. That's actually the point. And I really like actually the McKenzie method because to me, it's a kind of philosophy. And I am a philosophical person, I would say. So that's why I want to go to the end of it. But there's no end, but
Right.
definitely, but it's further, I would say.
Right. Yeah. Yeah. So we've got a couple of projects that have just been given to us today. You guys, I'm sure, have seen. We're shifting from that first week of looking into being more of a critical reader of research, both any paper that might refute things that we have a bias towards, as well as things that might support it. Was that a surprise for you that we jumped right into the research, Mehdi?
Yes.
Yeah.
It was actually. So
was that a challenge?
Yeah, it's a bit challenging for me now because I need to support everything that I mentioned.
Yeah.
So I'm not really used to it. This is actually my weak point, my weakness.
Yeah.
I need to work on it.
Yep. And Ruchi, what about you?
Same here, like getting research into practice is a bit tougher with every patient, and second week itself they have asked us to do that. Just fingers crossed, but hope we do well with that.
Yeah. Well, and it looks like we're going to get more into the clinical, looking at a case. However, it looks like we're also going to have to use literature to support our thoughts about the case. So now we're starting to put those together. It appears like that anyway. Do you have thoughts about shifting more toward the clinical? Does that seem a bit more comforting, like it might be more in your comfort zone? Or do you think that it's going to be challenging, Ruchi?
It is going to be challenging. Like whatever we were practicing for the past 3-4 years now, and things are going to change because I'm going to learn, I'm going to grow. But the time part with every patient, I think that is going to increase initially. What we were trying to finish in 40 minutes, maybe it's going to take a bit longer, 15 minutes to support the evidence and think about it because it's going to be a slow process initially. Once it gets into routine, I think I'll be better student.
Yeah. What about you, Maddie, when you think about maybe looking at a patient case?
I'm more comfortable with that kind of work.
Yeah.
Yeah.
Yeah. Yeah.
So
I think we all feel similar.
I feel more relaxed now.
Yeah.
I don't know how it's going to be challenging, but what I feel is like that. I'm more comfortable now.
Yeah.
So.
Right. Well, we'll see. I'm sure. I'm sure they won't make it too comfortable for us.
Yeah, exactly. Yeah.
Yeah, well, we've got a lot more. Obviously, we're just getting started, but I wanted to bring a few of you on just to chat about this so that those out there that have knocked around the idea in their mind about doing it might get a feel for it. So hopefully that's what we'll be able to convey over the next several weeks. So maybe now we can start placing a little bit of a name with a face, exactly. And watch how we go through and kind of share some challenges or some successes or how our clinical skills are changing through the process. So we'll see. But so maybe we'll get back together here in a couple of weeks and kind of just touch base as to, okay, what have you learned now? And how is that changing your practice or your thought process? So I appreciate you guys being willing to share a bit about yourself and about your situation and just your thoughts about the diploma program. And we'll be back in touch.
Thank you very much. Thank you.
And there you go with episode 391. It's been a privilege for me to get to know this fine group of people and group of clinicians, as well as the rest of our 2023 group of classmates. Stay tuned to catch my conversations with the CEO of the McKenzie Institute International, Helen Clare, and the International Director of Education, Richard Rosedale. Some recent graduates and new diplomats, Julie, Adam, and Paco. We'll hear from them about their retrospective look at the program as a whole and how it's paying off now that they're completed the program and back in the clinic. We'll also check in with my classmates mid-program and plenty more. It's all coming this season, season 13, here on the podcast. So be sure to subscribe to my email updates to be notified of new episodes. Subscribe to the podcast on your favorite podcast player or on my social media channels as well, so you'll be notified when new episodes come out. Again, we want to thank today's sponsor, the McKenzie Institute International, providing worldwide training and support to clinicians in the principles and practice of the McKenzie method for the management of patients with spinal and extremity disorders. The McKenzie Institute Diploma Program provides the highest level of MDT training. It enables clinicians to acquire an in-depth understanding of the McKenzie method and become experts in its effective use in guiding their patients to achieve their personal goals. If you have an interest in learning more about the diploma program, check it out at McKenzieInstitute.org. And don't forget, here at the podcast, we're continuing to plug away with my two resources, Case Conversations, that's our patient case discussion resource, and Inside the Science, our scientific paper summary and discussion resource. By the way, these are not associated with the McKenzie Institute, but are intended to provide some virtual mentoring for you and help keep you moving forward in your professional development. You can check them out at mechanicalcareforum.com. All right, I wish you a great week with your patients this week. Consider how best to continue to develop yourself. Overcome any self-doubting, and join us right back here next week for more from Season 13 and more of sharing experience for improved patient care.